a nation on edge. America's death toll passes 500,000 even as coronavirus infections decline.
Is this a national emergency?
It is a national emergency.
President Biden makes a promise to the American people.
We're now on track to have enough vaccine supply for all Americans by the end of July.
An ambitious goal that could be hampered by new variants.
We don't know what could happen.
Vaccines continue to roll out. Millions have already received their first dose.
We just need a date of when we come back.
But millions more are wondering when their turn in line will come.
I kind of think that we should have been first.
A Shot of Hope, Vaccine Questions Answered starts now. Hello, everyone. I'm Tanya Rivero. It is great to be with you. Thank you for joining us for this CBSN special, A Shot of Hope, Vaccine Questions Answered. Most experts agree one way out of the pandemic is with a needle, but news about coronavirus vaccines changes by the hour. A new shot from Johnson & Johnson could be approved by the weekend and in arms as early as next week. But the variants remain a concern. Moderna says it has taken steps to battle the new South African variant with a modified booster shot now being tested. Between Moderna and Pfizer, the U.S. has been able to distribute more than 90 million vaccine doses coast to coast. As of Thursday, nearly 70 million shots have made it into people's arms, with more than 46 million people receiving at least one dose and almost 22 million Americans receiving both doses. That is almost 7% of the total U.S. population. But as more vaccines become available, millions of Americans remain confused. What vaccine should they take? Is there a difference? When and how do they get it? Who should go first? When will things go back to normal? These just some of the many questions you are asking. This hour, we will try to give you answers. We've assembled a full team of professionals, including the foremost infectious disease expert in the country, Dr. Anthony Fauci, to give you the information you need about COVID-19 vaccines. We want to begin with distribution. My first guest is Bob Fenton, the acting administrator of Fema. Mr. Fenton, welcome. It's great to have you with us. So, U.S. rollout of the vaccine has been, as you know, frustratingly uneven. We've seen other countries, such as Israel, vaccinate their populations much more effectively. Granted, we have over 330 million people and a decentralized system. But what is Fema finding to be the biggest challenge with the vaccine rollout?
Well, I think there's a number of challenges. One, the supply of vaccine at the beginning of this is taking time to ramp up to meet the need. The president, since assuming office, has drastically increased the amount of vaccine. We're this week projecting over 14.5 million vaccine available to states, which is a 70% increase since January 20th. Then it's the next area is to focus on providing the resources to states and local governments to be able to vaccinate people. And the president has done a number of things to help that out. One, he's provided 100% funding through FEMA to states and local governments to help them with vaccinating. And that's been about $3.8 billion in 46 states, tribes, territories, and the District of Columbia provided. Number two, underneath his national strategy for the COVID-19 response and pandemic preparedness, he's also provided 100% funding to governors for their National Guard, which is critical because the National Guard is a tremendous capability to help with the vaccination effort. And then lastly, what he's done is provided federal resources to assist states and local governments. And we have thousands of federal vaccinators out there right now supporting states and local governments in their vaccination sites. In addition to that, we've established a pilot now where we have primarily federally supported state managed sites that are standing up throughout the United States to do mass vaccination.
That is certainly good news. Mr. Fenton, CBS News asked FEMA about reports out of San Francisco that the Department of Homeland Security logo on some vehicles in certain Latino communities is being covered up. Can you confirm that ICE and U.S. Customs and Border Protection are not conducting immigration enforcement operations at vaccine sites?
Yeah, they are not. DHS has put out a memo, and we've gone ahead and sent that out through many different methods that enforcement, that they will not conduct immigration and enforcement operations at or near vaccine sites, or for that matter, any healthcare facilities that are supporting people with COVID. So that is not happening. We are part of the Department of Homeland Security. We do rely on the whole of government, which includes entities like Coast Guard and TSA and other agencies to help us in the vaccination. The critical thing is that what we want is everyone to sign up. What we're doing is reaching out through faith-based organizations, community-based organizations, to make sure that those that have social vulnerabilities have the ability to get vaccinated. That's really important and really an underlining priority of what we're doing with regard to President Biden's initiative.
All right. Well, Bob Fenton, acting FEMA administrator, thank you so much for joining us. We appreciate your time.
Thank you.
We want to turn now to Dr. Anthony Fauci, the chief medical advisor to President Biden, as well as the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, welcome. So much to speak with you about and a lot of questions from our viewers. So let's get right to it. Dr. Fauci, there is concern about a new variant spreading in New York that some scientists worry may weaken the effectiveness of the vaccines. What can you tell us about how the vaccines already in circulation, as well as the Johnson & Johnson vaccine that may be approved soon, are responding to the variants, including this new one in New York?
Well, thus far, we've noted that the variants that have been gaining dominance in the United States, the one that was the first one that was of concern was the 117, which was the UK variant that clearly was dominant in the UK and then in the United States began to become dominant in the sense that if you do a model of it, it looks like by the end of March, that might be the dominant strain or variant, as we call it, in the United States. The good news about that, even though you always take these things very seriously, is that the vaccines that we have, when you look at the antibodies that they induce, really handle that particular variant very well. You don't like the idea of a variant that has a greater degree of capability of spreading, or that might actually have an increase in pathogenesis, which means it can give a more serious disease. But giving the vaccines that we have should handle them reasonably well. So it's kind of a bit of a race of the vaccine against the mutant, as well as making sure we keep up our public health measures. But other variants are emerging, such as the 526 from New York, which started off in a cluster of cases that was noted in the Washington Heights section of New York. But then over the next weeks or so, months, it was seen not only to be in Washington Heights, but also to be seen in other areas and other boroughs of the city. The degree to which this is able to be contained by the current vaccines or not is still being examined very carefully. We don't know exactly the effect or not of the vaccine there, but it is something we obviously always take seriously, have to keep in mind. And what we say, the best approach to the emergence of any variant is to prevent this virus from spreading. And you can do that by two ways, at least. One is by continuing to adhere to the public health measures that we continually talk about, the universal wearing of masks, physical distancing, avoiding congregate settings, as well as soon as the vaccine becomes available to you, please take the vaccine, because although it might not be completely protective against a variant, the data that we have so far show that the vaccines that are in use at least prevent very well severe disease that leads to hospitalizations and death. So get vaccinated and continue to abide by the public health measures.
Important advice. All right, Dr. Fauci, let's get to some of our viewers' questions now. The first question comes from Liz T. Liz says, I am allergic to all preservatives, fruits, and vegetables. I also have an autoimmune disorder. I'm concerned if I take the vaccine, I will have a severe anaphylaxis reaction. Can you assure me this won't happen?
Well, I mean, whenever you deal with a situation with an intervention, as rare as it might be, you can never assure someone that they would not have an allergic reaction. People who have a propensity to an allergic reaction, particularly an anaphylactic reaction, have a greater likelihood of getting an allergic reaction to a vaccine. But if you look at the allergic reactions just recently reported in the scientific literature, there's about between 4 and 5 per million vaccinations with the Pfizer and between 2 and 3 per million vaccinations with the Moderna. If you do have a history of allergic reaction, so long as you don't know if it's an allergic reaction to something you definitely know is in the vaccine, you might want to wait for another vaccine. But if you just are an allergic person in general to foods and other things, you can get vaccinated, but you should do it in a situation where you're in a location where someone can handle and treat an allergic reaction, rather than having it in a place where if you do get an allergic reaction, there was no way for it to be treated. But it is an unusual, if not rare, occurrence based on the numbers that I just told you.
All right, Dr. Fauci, here's a question from an actual healthcare worker. Haley T. is a vaccine administrator in New Jersey, and she says, patients often ask me whether they should be taking pain relievers either before or after the vaccine shot. I've heard mixed advice. What do you say?
Well, the mixed advice is based on the fact that there's very little data on that. I mean, if you're going to take something that suppresses an immunological response, then obviously you don't want to take something like that, except if you're taking it for an underlying disease. But if someone gets achy or gets a headache and it's really bothering you, I mean, I would believe as a physician that I would have no trouble taking a couple of Tylenol for that. So again, people are going to come back and forth and say, well, it could mute or dampen the immunological response to the vaccine itself. I don't see any biological mechanism why something like Tylenol would not do that. There's the hypothetical or theoretical, that's the better word, that maybe something that's a true anti-inflammatory, such as one of the non-steroidal anti-inflammatories, should not be given. But I don't think that's going to be a major thing. If you are really having discomfort, that usually would occur rarely after the first dose. The first dose, you likely would get a pain in the arm and maybe a little bit of an ache. Not very much of an issue there. That's what I went through personally when I got it. But the second dose of either the Moderna or the Pfizer, in some people do get about 24 hours worth of achiness, maybe some chills, occasionally a fever, a headache. You feel under the weather, as it were. Taking something, a pill or two, or, like 2 Tylenol every 6 or 8 hours or so, I can't see is going to have a major difference and might make you feel much better.
So, Dr. Fauci, we have another question from Caroline K. She asks about her first child that is due in May. Presuming I'm fully vaccinated at that point, what parameters do you recommend for social interaction with the baby and other vaccinated people?
This is a good question that we'll hopefully soon get some guidance from the CDC. But I can tell you as a physician and some common sense thing that if you are vaccinated and you are with a person who's also vaccinated and you have your child and that child is with you all the time, it just doesn't make any sense in my mind to be able to be completely restrictive, like a mask all the time, can't hug, can't do that. Now, what's going to happen? People are going to criticize my saying that because say, well, where's the data? Well, the CDC is trying to get some information about this by observing. It's going to take time to get it. So what likely will happen is that there will be a lot of caveats with that. But to say that the risk is not zero, but the risk is going to be dramatically diminished if you have one vaccinated person with another vaccinated person. What are the kind of things that you can do? I think common sense tells you that you can have some much more flexibility in these kinds of what we call public health measures that need to be taken. And again, I know that that's in a data-free zone because it isn't based on a study that anyone has done. And the CDC, being a science-based and data-based organization, is going to try and get together and make some kind of a statement about what you would do with that. But I think the risk has to be extraordinarily low if you have both of them who are vaccinated with a 94 to 95% effective vaccine.
Right. All right. Well, Dr. Fauci, thank you so much for your insight. Please stay with us. Dr. Fauci will be here to answer more of the questions you sent us a little later in the hour. And up next, fulfilling demand is only half the battle. Once the shots are shipped, they need to be administered. We'll speak with Montana Governor Greg Gianforte about what's working and what's not. Plus,
they did not know. They were not informed. They were lied to. He felt used. He felt deceived by his government as well as the people that he trusted in the medical field.
A dark history in American medicine has led to vaccine hesitancy, why some Black Americans do not trust the shots, even though COVID-19 has killed more in that community than any other. Our CBSN special, A Shot of Hope, Vaccine Questions Answered, continues next. But before we go to break, the latest from our CBS News polling unit. Who actually plans to take the vaccine?